Okay, what about Tuesday at 2:20?
2 hours is a long way to drive for a doctor's appointment.
So we'll look and see what the best option might be.
Pediatric Sleep Medicine Center patient Mallory Kimmer and her mother Marika are happy to save the time when they can.
This has been really great.
East Tennessee Children's Hospital helps save that time and social distancing through telehealth appointments. It's another option for face-to-face interaction to ensure kids get the care they need.
I have a full-time job, and I was going to have to take off vacation or sick time to drive down there, and it would have taken at least a half a day or maybe most of the day for the time of our appointment. So the telehealth has been really great.
She says even though they're physically far apart, there's a personal connection between them and the medical staff.
We were able to get all of our questions answered without actually the convenience of being here and not having to travel down there.
That it fits well, that it seals well.
Children's Hospital's telehealth use keeps growing.
The families were really engaged. The providers were really engaged.
Director of Virtual Health Services Rick Simpson says COVID has increased the hospital's ability to use video conferencing technology to connect to patients.
You could have one parent that's at work, you could have one parent that's at home, and then you could have the child at school. Or at grandparents or whatever the case may be, and then you can have all of those people still on the line at the same time and be able to continue to have that service for them, and everybody can participate.
Simpson says it's an extra level of protection during a time when social distancing is a priority. You don't have to bring your child into contact with more people than they have to. It also gives doctors a chance to connect on an even more personal level.
We've had the opportunity to see how these people actually interact in their own environment. We usually don't get to see that because we're what we consider in this clinical box or this clinical area, and as much as we try to make it a home experience for them, it's not the same sometimes. And so it's really interesting to see them in their own environment. So that in and of itself allows us to do a better job.
Mallory and Marika Kimmer say they would happily continue with telehealth calls in the future.
This telehealth has opened up a whole different ability to stay in contact with your own personal doctor.
Be sure to ask your Children's Hospital physician or subspecialist if a telehealth visit would be beneficial for your child.